Dear colleague, the case that I present today is peduncolated uterine angiofibroma. Comes to our attention a patient over 52 years, from about 5 years in menopause, reporting pains in left annexal. It is necessary to specify that you are looking at the mass. Is labeled by us as the left ovary, and only during surgery will be highlighted to be of relevance uterus. Our assessment starts with the specification that the pedunculated uterine angiofibroma is a rare disease usually seen in patients of fertile age. While the patient was observed by us in menopause for about 5 years. The date that we have to show beyond the age of the patient the clinical history. In fact, the patient shows an exam performed about 10 years ago, which evidenced a regular ovary left, and then all of these brings us to think that the mass had an ovary. Also note the echo structure of this mass, with these cyst-like formations to report to ovarian stroma, because being examined we observed no other structure to be referred to the left ovary. The uterus is intubated with the myometrial echostructure inhomogeneous by widespread nodules, and keep short even the right ovary that looks regular for volume and echostructure. And we know that a malignant disease is usually bilateral. There was no ascites, and there were no effusion in Douglas. Advise the patient to the execution of the TAC that performs is subsequently required at hysterectomy. During surgery, it's observed that the formation that we described previously thought to be of ovarian origin, later proved to be of uterine origin. An histologic examination showed him how pedunculated uterine angiofibroma. Our reconsideration of the examination performed is that the cyst-like formations were small areas of colliquative fibroma. A mass was richly vascularized, but still showed high resistance, induced us to think that this formation was benign, because the right ovary, as we have seen, had a regular echostructure, a regular parenchyma. The malignant disease usually is bilateral, and in this case, it's not. This case makes clear to us that the suspicion of ovarian disease almost always requires histological confirmation. This is a note of caution, especially when it comes to our observation, a patient presenting menopausal annexal masses. Thank you for your attention.